taught by the University of Maryland School of Public Health. And of course, we are the cutting edge where we discuss all things COVID-19, health, wellness, and beyond. Today, we're going to talk about leadership and how leadership matters and how public policy impacts public health. We got a excellent lineup of guests to help us unpack this most important discussion. We have Eleanor T. Bell. She's the CEO of the H.T. Bell Connections. She's the former mayor of Hayneville, Alabama. So we have something in common there. So we're going to talk a lot about how public policy, particularly as it relates to municipalities, look at public health. And we have a dear friend of mine, both of them are, Dr. Vanessa Enoch. She's the president and CEO of Cultural Impact, LLC, former congressional candidate. She was the nominee for the Democratic Party. And of course, we are so proud of her really putting herself out to be a servant leader. And so we're going to talk about how, even as it relates to not just municipalities or the county or the state, but also how the federal government impacts the public health through their policies and legislation and that kind of thing. So we got it covered. Now I don't do this by myself. You all know that if you've been watching us for over a period of time, you see that I got a sidekick. He's a brother from another mother. It's Dr. Stephen B. Thomas. He's a professor of the University of Maryland School of Public Health and director of the Maryland Center for Health Equity. This brother is doing some things. I'm so proud of him, and we'll talk about that later. But he's doing some things in the public health space that is revolutionary. He is transformational in his leadership style. Ladies and gentlemen, please join me in welcoming my co-host and friend, Dr. Stephen B. Thomas. Hey, Dr. T, how you doing?
You sure know how to blow a brother up, don't you?
All true, all true.
You know, it's an honor, and it's humbling to recognize how far we have come.
Oh yeah, man. It's when you see growth take place, it's the disequilibrium that allows for growth, right? If had it not been COVID, who knows? We probably wouldn't be doing this. I mean, we don't know, right?
Think about it.
So, right. So disequilibrium allows for growth. You got to go through it in order to get to it, right?
Yeah, another T-shirt going.
Oh, there we go. There's another Omarism.
There you go. But Mayor,
go ahead.
For me, it's the silver linings. Mm-hmm. There is a silver lining to this pandemic, and I think the window is still open to recognize what needs to be kept as we see the retreat going on around the country. So you said it more than once that the pandemic is not over with us, okay? And it's definitely not over. So what an amazing show we have, because public policy is front and center. And I'm still going to be bragging on the fact that Maryland really showed the way. Come on now.
Now I know you want to talk about your new governor. You go ahead and flex if you want to. Go ahead. I know you're going to do it. I'm giving you the floor, Dr. Stephen B. Thomas. Go flex, Dr. T.
I am telling you.
But don't smile like that. Don't smile like that. Go ahead.
Westmore took it away. And here was his campaign tagline: leave no one behind. Have we not been saying that right here on the cutting edge? Okay. Now we know we can't save everybody, but we can give everybody the information and wisdom they need to take action. And that's what I like about this show. And that we have elected officials here. You've said this more than once. They are servants of the people. And we, as the people, or those who can give voice to those who don't have one, need to make sure that these elected officials are held accountable in ways that are positive. Mm-hmm. You helped me when I said, should I go in there talk about why those elected officials did not show up in the shops? Remember that conversation?
Right.
And you said, invite more of them.
Mhm.
And just that little inflection opened up a much broader conversation. And I think moving forward for 2024 and beyond, the kind of civic engagement conversations we've been having in this space need to be even more robust. And that's why I'm so excited about our guest today.
Mhm. Yeah, but we don't do this by ourselves, right? We got a team behind the scene, and that team is headed up by none other than Meg Jordan. She's our technical director. She's assisted by Maggie Daly. Saraya Khan is our social media and communications guru, and of course, the music that you heard coming on our theme was designed by our sound designer, Elijah Pugh Jr.
There we
So
go.
we are so happy to have those individuals who make what we do work. And so we are lucky beyond measure, Dr. T, to have this
That's right. That's right.
this kind of supporting team. Yeah.
With, without them, we'd just be talking to each other.
Well,
Might as well just get on the
probably
phone.
somebody just go to the phone, might as well, right? Well, that we got to get this thing out. So we have really tried to proliferate this broadcast to as many spaces as we can in the social media space. We are on Facebook, YouTube, Instagram, and Twitter, and some others as well. So we'd like for you to like, share, and subscribe to our channels, and we promise that each and every cutting edge show, we're going to bring you something that is informative, but also entertaining. Entertaining. This is infotainment.
There you go.
So we're gonna have some fun. We're gonna laugh. We're gonna joke. We're gonna be like we are in the barbershops
There
and
you
in
go.
the hair salons. That's
Our
the
sacred
theme of
space.
this. That's our sacred space. So
That's
that's
right.
what we're gonna do on this on this show. And of course, don't forget you can subscribe to our newsletter. Comes out each and every week, even weeks that we're not on the show. You can get our newsletter. It will kind of chronicle what we've done over the previous weeks, and it gives you information that you can use, pertinent information that speaks to contemporary issues and really wonderful takes on things that we've talked about on the cutting edge. We also do vignettes of our previous guests, and so you'll see little snippets of them on there, and each you can get the previous show on every newsletter. We also load up the previous show, and so
That's a
if you miss a show, you can always catch it on the newsletter.
that's a nice feature, and we include the Public Health Minute.
Right, absolutely, which is so very important. Always, Meg Jordan does a wonderful job with the Public Health Minute each and every show. So we got a lot of stuff going on. Well, Dr. T, you ready
Here we go.
you're ready to bring our star lineup on? Are you ready?
Are you ready to rumble? Because that's
Ready.
exactly what we're being told to do. Don't back away from the front lines. That's
Yeah.
why I love how we call them the warriors.
Right.
So let's bring them up.
Right. So let's bring up Helena T. Bell. Let me say this, and you all can read her stuff. And I call her mayor. She's the former mayor of Hayneville. But every time I have seen her, she smiles. I don't know what it is about her personality or her spirit, but she's always just pleasant and smiling, very focused. She's done tremendous things. She's a entrepreneur, business person, own a funeral home. Not only that, she has managed multi-million-dollar infrastructure projects, and she now consults municipalities on how they can deal with health issues and other issues in their municipalities. She was an elementary school teacher and was a social worker at the Russell County and Elmore County Department of Human Resources. She is talented and multifaceted. Ladies and gentlemen, a sister from another mister, my friend, Mayor Helena T. Bell. Hey, how you doing?
Hey, good. So thank you for all of those kind words, and it's so good to be here with you tonight. Thank you so much.
Absolutely. You know, we got some, you know, as mayors, oftentimes, you know, we're thinking about potholes and you know, you don't, I don't want to give you flashback, right? but what, you know, but you know what? And we talk about that in terms of infrastructure, right? But I was talking with the team, and Meg was telling me the greatest infrastructure are your people, right? That's the
Yes.
foundation of your community, is not the roads, it's the people, right? And so when we're talking about public health, we're talking about addressing human capital infrastructure, right? And that's why I want us to be more intentional about assessing the health of your community, trying to see what is causing for unhealthy conditions, and then increasing the protective factors to make a healthy community, right? And with intentionality. And so that's the kind of work we're doing. Now, I do know that you're working with the mayors of Alabama too. So tell what's your role there?
Well, several things. You touched on so many critical points for our citizens that are in our cities. One of the things is healthcare, of course. You know that in the Black Belt, we tend to have so many health problems. Well, a healthy and unhealthy community tends to not thrive, because
Right.
how can we thrive when we're sick? And there are so many things that are affecting that, even down to the infrastructure, the water and sewer infrastructure. You know, I'm sure you've heard so much about the infrastructure in the Black Belt, how we're not having proper sewage. If we've got so many straight pipes on our homes and sewage is running on the ground, then here we go with the diseases. So all of that is a factor on our human capital that you just talked about. So that's one of the things that I'm involved in heavily, is working with some great folk from the State Department in trying to make sure the funds get to the most needed places in our Black Belt. As far as water safety, trying to make sure that wherever there's lead and copper, EPA has a great program out for replacing lead and copper that's found. So we're working with our mayors on that issues and our water system on that issue. Also working on a grant right now called Advancing Health Literacy. So we are, that came out of COVID, of course, to make sure that we get COVID vaccines into the arms of our people, but not only just getting the COVID vaccines into the arms of our people, but educating our people so that we can have a better quality of life. So there's just so many things that are going on, and I'm blessed to be a part of them and to have served as mayor of our town for 8 years. It just kind of gave me a very good view of what the needs are and what some of the barriers are for those folks that are elected officials, and letting them know how to overcome some of those barriers as well. So I've been placed in a great position, and I'm so fortunate to be surrounded by great folks like my Mayor Neal. I'm just privileged to know him and have him as a friend to stand beside me in this work.
Absolutely.
You know, Mayor Bell, I feel the same way about Mayor Neal. And between the two of you, I salute you. Watching those campaigns, there was a point where I just couldn't even turn on the TV. It was just too much rancor. And recognizing the sacrifice that you put yourself through and your families when you run for office. I think we're all being called to be more involved locally. And it was a piece in your bio, and you mentioned it about water. And so, you know, sit in the mayor's chair for a moment here, whether it's Flint or Jackson. And how important, when you're the mayor, does advocacy on the part of the community, organized groups, let's say the barbers and stylists, finding voice and communicating with you their need? How important is it that you need to hear from the people in order to move agendas when you're sitting in that elected seat?
Oh, absolutely. It's important to know the needs of the people and have those voices standing with us as an elected official. That is not just your idea or what you are assuming is happening in the community. It's having your constituents standing with you, standing beside you, writing the letters or going to the meetings with you, going to your legislators alongside you, because you're not doing this alone. All of us that when we sign our name up to become a public servant, like Dr. Vanessa, she just said that she just came out of a campaign, and I applaud you for your efforts and all that you've done, because I know that was huge. But just having the people to stand with you, because we promised to stand with the people. That's what we're there for. We're here to help the people, not to highlight ourselves or to make ourselves shine. We want to help our constituents to have a better quality of life.
Thank you. Thank you.
It's very.
Yeah, well, I'm excited about this conversation, particularly because public health is life.
That's right.
Because if you don't have health, you have nothing. Health is your wealth.
That's right.
And we have to look at it from that vantage point. So thank you, Mayor Eleanor Bell. Well, let's go to Dr. Vanessa Enoch. I call her Doc Enoch. She is a dear friend of mine. We've known each other for many, many years. She's the president and CEO of Cultural Impact LLC. She is a business owner, a consultant, an organizer. When I first met her, she was doing some significant study and assessment of injustice within the justice system against a judge in Cincinnati. And from that point, when I saw how committed she was to help Judge Tracy Hunter, and she was like committed beyond anything I'd ever seen to make sure that justice prevailed. And I thought about Dr. King, where it says when justice rolled down like water and righteousness like a mighty stream, how important that is. Well, she won't stop until justice rolled down like water and righteousness like a mighty stream. Ladies and gentlemen, please join me in welcoming my dear friend, Dr. Vanessa Enoch, back by popular demand. Hey, Dr. Enoch, how are you doing?
Snap her to the stage.
Absolutely. Good. Hey, Dr. Enoch, how you doing?
I'm good. Thank you all for that warm welcome. I feel like I'm at poetry night in the barber shop.
There you go. The sacred space.
Well,
Exactly.
First of all, congratulations, Dr. Enoch. Dr. Enoch was the Democratic nominee for congressional district in Ohio. And we know that winning it's multifaceted, and so you did win. Even though you don't go into the legislature this time, you did win. You raised issues. Your name recognition has grown exponentially, right? And we hope that you stay focused, because this is not a sprint. This is a marathon, right? And so we have to continue to run until we reach our destination. So I commend you for the work you do, and just as with Mayor Bell, this is not easy to put yourself out to run for public office. I don't know if for those who've never run for public office, you don't just run, your family run, your friends run, everybody that's connected with you run. And so when you commit yourself to that, it's got to be a higher calling. There is a saying that in the Bible where it says you take the greatest among you and you make them your servants. And so we appreciate your servant leadership, Dr. Enoch. So tell us, I know you can exhale a little bit now. I know running for office. Tell me how you feel. What's up?
You know what? I'm over here trying to exhale after this very, very long marathon. So it is nice to actually have a little bit of peace and quiet, but what that has meant for me is getting back in the swing of ordinary life and running my business and getting everything and everybody back on track. So, there's no rest for the weary. And hey, we're back at it over here and trying to do some important stuff in Ohio. And so, and really as an outgrowth of what has happened in the pandemic, much of the work that my company is doing right now is trying to help repair the breaches and to fix the things that, we understand now are broken as a result of the pandemic. And it was a definitely a good time to be running, to tell the story of the challenges that communities face, because, a lot of people don't think about the various perspectives in government that shape policy. You have one group of legislators who believe that people should pull themselves up by their bootstraps, ignoring the fact that many of us don't have bootstraps, right? And then you have the other side who is, attempting to shape policy to impact communities that have been really ravaged by what has happened through the pandemic, but even moreover, trying to rise from those ordinary challenges of some of those social determinants of health, like a lack of education, a lack of insurance, and, all of those kinds of things that ordinarily plague communities. We're now having to dig ourselves out of those things and to help people understand what these legislators, either don't understand or don't care to understand. And so that is the place that I'm in right now. The work never stops, even though the campaign has stopped. I am fighting on a different front now, but definitely not giving up the fight and making sure that an impact is made in all aspects of the issues that I raised during my campaign.
Dr. Enoch, as I'm listening to you at the end of a long race, is the strength of your voice. So it is still coming.
When you run, that's when you get stronger, Doctor.
It is coming through loud and clear. And I hear echoes of your understanding of public health and the social determinants. Boy, that's like a song to me. And looking at your background, it talked about your work in information technology. And so now I'm interested to what extent the technology that's now allowing us to do this Zoom and many of the things that happened during the pandemic could be a great leap forward for us to achieve some of the goals that you had in your campaign and all of us, particularly as it relates to improving health and those social determinants you talked about.
Well, for sure. There was an information gap, a knowledge gap, a technology gap in the African-American community that had persisted long before COVID. And COVID enabled many of our communities here locally and across the United States to access technology that they had never before accessed. In rural areas. And if, you could go back to the Wayback Machine and look at my webpage and my platform back before COVID. And I was saying we need to improve technology. We need to make sure that we close the technology gap. We need to give access to African-American communities and lower income communities and rural communities. And that conversation fell on deaf ears before COVID. And after COVID, everyone had to be given access in one form or another to technology just to continue the education system. And so, although many young people fell through those cracks during COVID, the pandemic essentially gave access to many young people that just never had access. So, in a way, the pandemic had a good effect on access to technology and making sure that, we level the playing field, so to speak.
Another silver lining,
Yeah. Dr. T, Dr. Enoch and I were talking about policy, and particularly doing policy audits, because many times you go into office and you kind of just assume everything that has happened, and you kind of continue with maintenance of the status quo. And Mayor Bell, that when you go in, you need to know what is in order to know what you need to do to address the issues that you face directly. So how important, I want to ask both of you, how important is it to assess your policies as it relates to public health in order to shift the paradigm on the approach towards public health in your respective jurisdictions? Start with you, Mayor Bell, and then Dr. Enoch.
I'm in a rural community, so of course it's challenging, but it is very important. Technology is, and of course, just like Dr. Enoch said, during the pandemic, we found out that we knew we had gaps, but oh my God, we had no idea it was, I'll say the powers that be had no idea that it was as bad as it is. We knew living here, and we were already screaming that, hey, we need help, we need funding. But then when the children were impacted, not being able to attend school or get online with their classes, and then when, as far as telemedicine is concerned, that became an issue also. And with the local leaders trying to address those issues, they found that even in the offices, in the governmental offices, there's lacking as far as technology is concerned. So the conversation can just go on and on about the issues there.
Yeah, I want to piggyback on something. Dr. T, you would think that if you are in the government, that you would have the latest technology, right?
Right.
Man, please. Dr. Enoch, you can go into places, they got those old towers, not even new technology. I mean, old towers, they've got dust on them from 30 years back. They've not even upgraded. And with the new 5G and all of that, they have computers that don't even have the cameras on them. I mean, so how are you going to do Zoom if you don't have a camera or audio on a computer? And that's not, I'm not talking about in the rural area, Mayor Bell. I'm talking about that's in the state buildings. Is that correct? Am I wrong for saying that? That's true.
Mayor Neal, across the country, we found out just how archaic the technology systems were within government infrastructure, and just trying to roll out unemployment across the country for everyone who was impacted. They figured out that the technology systems were built on COBOL, an old programming language, and it took, they had to hire people, bring in consultants and everything else just to program systems to be able to handle implementing a nationwide unemployment structure in order to make sure that people had access to those systems. So I absolutely can identify with what you're saying. I think the other thing to think about as it relates to policy and issues with policy that we understand when it comes to public health is the unintended as well as the intended consequences of public policy. You know, we figured out only during the pandemic how it is that all of our health impacts one another. You know, when folks in the healthcare industry, for example, got sick, and you know, they take those illnesses home with them, and then the entire family is sick. But then you consider things such as children in school who could not be vaccinated, or people at work who did not have insurance, and as a result could not get treatment. And so, you know, the government had to step in and make sure that vaccines were available to everyone. And for the first time in at least the history of most of us being alive, we had to deal with the issue of a lack of access to insurance for everyone.
Yes.
You know? And in that way, yet again, Dr. Thomas, we now, you know, also figure out that there's another silver lining in this whole COVID thing, where now we have to look at how are African-American people impacted by COVID, because they became what we now call essential workers, right?
There you go.
Right.
The garbage man
we
became
show enough the essential workers, right?
Exactly.
Front
and
line.
and some of those essential workers did not return to work for one reason or another.
Right.
Some of them are suffering from long-term consequences of having gotten COVID, and many of them are dealing with having worked in industries that are leaving them susceptible to the potential for being ill all the time, like healthcare workers or childcare workers and that sort of thing. So we're learning some very valuable lessons in how all of these things are connected and how we're connected to one another. And so I think that those are, when we think about policy, those are some of the things that need to be part of the ongoing conversation.
Right.
You know.
Right. You mentioned it, that people, Mayor Bell may have said it, they act like they don't know. Well, if you've been in leadership all these years and you don't know these people have been suffering, right? I don't buy that. I think they know, they just didn't care until it impacted them. Right. And so then now we got to do something about it. Greg Allen, bring him up a second. He had a question. I was going to ask it for him, but I want him to ask it for himself. Hey, Greg, how you doing, man?
Unmute yourself,
Unmute.
Greg, and just say who you are.
Hello, everybody. I'm Greg Allen. I'm a co-owner of My Bella Barbershop, and I'm also an IT consultant. So when you guys talk about IT and healthcare, I get really interested. I spent 9 years doing IT construction in a hospital. And so you guys are talking about a lot of things that come together for me. And you made mention that the government has a hard time keeping up with the IT changes. And so when this pandemic hit, it took some time to adjust. With that new understanding of how important IT is in the rest of the world, are you guys seeing more investment, more understanding that you can't let systems get to be 8 and 10 years old and think you can survive if something else comes up? Share what you're seeing now with policy and in the meetings that you guys attend.
Okay, that's a good question, Greg. Thanks so much. Go ahead. Either one, Dr. Enoch or Mayor Bell, either one.
One of the things that I actually saw in real time was, as they were rolling out COVID funds, the policy, everything was just changing day by day, changing. And then you saw where technology became more and more, okay, you can use these funds to pay for this. You can upgrade your technology in your office now. Oh, it just changed. You could buy computers, you could buy this, you could buy that. So technology became extremely important as COVID went on and on, because I think initially they thought maybe it was COVID was gonna be over pretty quickly. Maybe it was announced that, oh, COVID is gone, but it really wasn't gone. So in order for the government to stay operational and to do business, the policy had to change as to the way funding was being used. And now everyone knows, oh, we have to keep our technology up to date now. It's like, it's urgent. It's just like water and sewer.
Yes.
We have to keep that infrastructure in place now. I see the urgency.
Yeah,
Absolutely.
Mary Knock. Excuse me, I'm calling you Mayor. Dr. Enoch.
I think it's important to recognize, even within the infrastructure bill and the Inflation Reduction bill, that technology has now taken a center stage in both of those. Here in Ohio, for example, $22 billion was allocated to build a new Intel plant, which will become the biggest producer of chip technology, and that'll make Ohio the biggest producer in the world. And then also Honda is building a plant here, another couple of $2 billion to build a plant here for producing the batteries for electric vehicles. And some of the automakers have made a commitment that they will no longer be producing gas operated vehicles. Honda, for example, has now said, over the next several years, we will no longer be making gas vehicles, which means that the technology infrastructure will have to be built out across the country, which is what the Inflation Reduction and the infrastructure bill is going to fund. And so, yes, absolutely, technology is now taking a center stage. But what we will see happen as a result of that is, once access to that kind of technology is accessible throughout the country and the infrastructure is built up and redesigned, it will also improve access to all sorts of opportunities in the rural areas that has never before been available. We're going to see a lot of that going forward. And so technology will become even more part of our daily lives and building up for jobs of the future, which means that education is also going to have to take center stage. We're going to have to make sure that our population is educated. And with the browning of America, which one faction of our country has been fighting the browning of America. But with the browning of America, we need to ensure that we make a significant investment in our young people to make sure that they're ready for those jobs, to make sure that they have access to the information so that they can take jobs in the technology sectors. And so, yeah, we're definitely heading in that direction at this point.
Dr. Enoch, if it wasn't illegal, I would be voting for you in Maryland. I am telling you, because, we're trying to bring the technology of the smartphone into the barbershops to help monitor some of the high-risk behaviors. And Greg Allen is a part of our team to make that happen. So this whole notion of lifting up the silver linings of the pandemic and adjusting our policy, because think about it, equity was the lens. At the end of the day, we did things to ensure there was equity, be it rural access to telemedicine, or all the things we did to help put needles in arms through barbershops and salons. The public health emergency that makes this possible will expire in January. And when that expires, we go back to a commercialized operation. So we need to be speaking up right now, would you say, in terms of the elected officials as they're coming back and huddling about what their agendas are going to be? Mm-hmm. Is this the time to be communicating with them?
It's absolutely the time to be communicating with them. But if you look at their agenda does not include any of this. In fact, they're doing everything they can to reverse the policies of the pandemic, and even to go so far as to investigate the various levers that were employed in order to ease the suffering throughout communities. They're looking for ways to turn the clocks back. And so it is absolutely a time to be talking to them, but even moreover, a time to be building coalitions
Okay.
and educating the community, because without the pressure from the community, our legislators are not listening. They don't care.
Okay.
That's where the
the message.
barbershops and the hair salons, that's where
Here we go.
That's that activism that we're talking about. Bring up Dr. Carol Ritter. Let me talk to our resident OBGYN doctor. Hey, Dr. Ritter, how you doing?
Hey, I'm doing fine. I'm actually having IT issues here in Wisconsin. I mean, maybe that's a way that they like control the vote on here too, because I don't have any problems in Maryland with my IT, but
See how she likes Maryland.
You know what? You in Maryland. God,
well,
Dr.
it's exciting, right?
Go ahead.
But I did want to say something about the IT with the pandemic, though, from a practical physician point of view. I mean, things happen so fast, and Epic didn't keep up with it, right? Docky Knock. That's how I heard him say your name.
That's
Docky
right.
Knock.
That's
I love
my
it.
name for her, Docky Knock. I just
Docky
love
Knock.
it.
He started it, and now there are about 800,000 people in the greater Cincinnati area who now know me by that name.
I love it.
But
I
I
love it.
started it. That's my name for her.
You own it. But
Yeah.
when the vaccines came out and they gave them to the hospitals, they couldn't give them out right away. You know why? Because there was no drop down in Epic. There was no code. There was no billing code. There was no way for them to actually give it. And the same thing when they changed the algorithm for the renal,
That's right.
algorithm. They couldn't implement it right away because they had to change it in the electronic medical record system, and that took time. Okay, so all these algorithms, they collect data from the cultural behavior, and the cultural behavior of medicine hasn't been brown, it's been white, right? So
Yes.
it's really, we have to watch this technology. It's
Absolutely.
good, but we have to really keep monitoring it.
Algorithms of oppression.
Wow.
And when I think about the Supreme Court decision that would make your practice in Maryland something you would do in Maryland to save a woman's life, and if you were to do that in the state of, you name it, Texas, Florida, it would be illegal. Even Ohio, it would be illegal. Really?
Yeah. And criminalizing doctors and people, Uber drivers. I mean, come on, man. It's but that's why it's so important to vote. When we talked about, how important it is to vote, and we're gonna talk about that as well. What I want to do, Doc, let's get a pulse, right?
There you go.
Let's go get a pulse, and then we'll do the public health minute, and then we'll come back and we'll have some more conversation. Okay, let's get a pulse. Doc, tee it up.
So for our guests, we'd love for you to take a moment and think of a word that best describes how you're feeling right now in the pandemic, and just drop that word there in the chat. For those of you in social media, you can use the Q&A box and then put as many words as possible, one at a time. Don't worry about spelling, just get them in for the next 60 seconds. And the crew behind the team behind the scenes was going to build a nice word cloud. And the more people that see a word or say a word, the larger that word will be. So let's see where things are. So Dr. Bell, just keep those fingers on the keyboard and keep typing whatever comes to mind, Dr.
Let me say a couple things. I'm so glad that we're talking about issues
Yes.
that are important. And again, we cannot, one of the problems is when people vote and the voting season is over, meaning the election is over, people retreat back to their homes. They don't stay engaged. And then people who get in those offices feel like they're cloaked with this notion of invisibility, right?
There you
So
go.
they don't address those critical issues because we don't have report cards
That's
for
right.
people, right? We should have a report card, because the best indicator of what a person would do is what a person has done, right? You know, so we need a report card for everybody, and as they, not just when they get ready to fail, and
Right.
all the way through. You have a midterm, don't you, Dr.
There
T?
you go.
So,
The
you know,
equity report card. Yes.
right. We need to be able to do assessments and that kind of thing. And because people represent the people. This is a government of, for, and by the people.
And so
Right?
imagine we have barbershop polls along the way. You get the midterm, mid-course, but it's the barbershop's mid-course review of you.
That's exactly right.
And do a
And-
poll right there on the front.
Absolutely. And then, you know, we can put it up so people will see, you know, you failing now. We're gonna give you a chance because you got another year or so to bring your grade up. But right now you are failing. Go ahead.
Coming from you, Mayor, I just want to say this. It's like when we have our friends in office, if I voted for you and you're in office and you're handcuffed or one hand tied behind your back because of a broken system, I may be hesitant to criticize you. Now, my question is for all of those who have run for office and held it, and do you need your friends to criticize or to put pressure on so that you can move the structural barriers in that system? Or are we making it more difficult for you to be critical? I really like to know that.
You know, let me say something, let everybody else respond. It's not critical when you have expectations of your leadership.
Okay.
Right? Now, we understand that in government that you are one vote. And if you're not in the majority in certain places, there may be incidents where you cannot get what you are advocating across, or they can't get legislation or policy or whatever, because you have other people to whom you have to win over. However, I can hold you accountable for your advocacy.
Okay.
Right? At least advocate for me. Act
Okay.
like you want to do something for me, right?
And certain groups are really, really good at that.
Right. You know what I'm talking about. And then we can measure whether or not, you know, you couldn't do it because of structural things and
Right.
other things. But at least, you know, that's how a lot of people say, well, I couldn't do it. Well, you didn't try. Right. You know, so that's the difference, right? So that's the work we have to do, but we have to get that done. Well, let me see. We don't have the word cloud is not ready yet. So keep on going. Go, Doc Enoch, you want to say something?
Yeah, you know, I think where our failure is that we don't understand the language that politicians are using. For example, when they say things like cut taxes, what they mean is we're going to cut social programs. We're going to get rid of Social Security. We're going to get rid of Medicare. We assume that legislators are being elected to represent people. However, legislators have shown us time and time again when they vote against our interest that they are really truly representing those who funded their campaigns, the big corporations, big banks, big pharma. And now you have a conflict of interest, but that was brought on by some of the decisions that came out of the Supreme Court, which allowed, like Citizens United, for example, which allowed the corporations to have a voice and all of this dark money to flood into campaigns. And so now legislators are not concerned about what we as individuals are concerned about. They're concerned about making sure that they make their funders happy, that they are passing legislation that is going to be in the best interest of the banks who funded their campaigns or big pharma who funded their campaigns, not necessarily the people. So we've got to wrap our minds around what they mean when they use certain language. For example, the man that I ran against, he never made promises to people. And in fact, He even brought out the fact that corporations have a voice, right? And that donations have an impact on decision making.
Mhm.
And so he's not hiding, aside from to say that we're going to cut your taxes. What he's not saying is the tax break that we received was temporary, but the $1.9 trillion tax break to the wealthy was a permanent tax break. Ours had diminishing returns. After 8 years, those tax breaks no longer exist. But you cannot educate the populace and help them understand that they have short-term memory loss. And by the time the next administration came in, they blame, the fact that they no longer have the tax break on the next administration when it was done strategically by the previous administration.
It's almost as if we need a dictionary and a playbook.
Exactly.
That's what-
Exactly.
That's what we call selective amnesia.
There we go.
You know,
And
Yeah.
yet, in both of you, as you're talking, before we pull that cloud up, and Mayor Bell and Dr. Vanessa, I still hear hope
Yes,
in your
absolutely.
voice, in your tone, in your direction.
Absolutely. Because you know what I believe in? I believe in the resiliency of people. I believe that people, as Mayor Neal's show consistently reminds us, his radio show, You've Got the Power. I believe that people have the power to change things. And when people recognize their own power, they show up to the polls. I don't know what turnout looked like on your end in your cities, but I'll tell you, turnout here was disappointing. People did not go to the polls. And we told them what was at stake, the potential to lose your Social Security, your Medicare, blah, blah, blah. We told them. And so what we have to do is to continue to hold out that hope and to continue to educate people, continue to help them understand the impact that public policy is making on their everyday lives.
mhm.
Yes.
Yeah.
That's where hope comes from. Hope comes from knowing that, change does happen, and over time, to understand how that change happens, and educating the population and helping people understand is step one. And then step two is getting them to act on the information that we've now delivered to them.
You've sure come to the right place with that message. The cutting edge, right?
The cutting edge. That's where it is. Let's bring up the word cloud. Thanks so much, Dr. Enoch. Community. Dr. T, community is really two words. It's common unity, right? So it's as we see ourselves as a collective, that we are not isolated, observant, honored, vote, focused, excited, calculating, love, hopeful, united, persistent, frustrated, hope again, and vision, work, building better, observing, concern, unity, voices. All of those things are what people are thinking. But if you look at it, I'm honored to be a part of a community.
Indeed.
And that's what it's about. I'm honored to be a part of a community. I'm honored to be in this space with you all, to have this kind of cerebral conversation, very, very open and honest dialogue about our future, our collective future. And so that's what this is all about. Let's go to a Public Health Minute. Meg Jordan, Public Health Minute, and then we got a couple more things we're gonna do. Meg Jordan, our technical director / Public Health Minute guru.
All
Meg
right.
Jordan.
Good evening, everybody. So tonight we're going to run the numbers. At this point in the past 2 years, we have had 97.8 million cases of COVID in this country. 1,070,000 people have died from COVID. That's 4,000 since the last 2 weeks. 227.8 million Americans have gotten vaccinated. There's actually been a jump. More Americans are getting vaccinated in the past month, which is great. And we are at 31.4 million boosters of the new bivalent boosters given. Every one of those 227 million people is eligible for that 31.4, except for children under 5. So if you have not gotten your updated booster, please get that before the holidays this year. Next, please, Maggie. Okay. So where are we in the COVID community levels? So it's rising still. We have 84 counties in this country where every person should be wearing a mask inside. And we have 676 counties where people who are at high risk should be wearing their masks while they're inside. So take a look and see if you were in one of those places. Next, please. All right, so for the Public Health Minute today, we're going to be answering some questions about how to be healthy for the holidays. So next, please. The first question came from Mike. So how do you know if you have COVID, flu, or RSV? So they all kind of feel like having a cold. So how do you really know which one you have? You get tested. So all of these, you can get tested for all 3 of these. All 3 of these tests should be available at urgent care. They should also be available at your doctor. Until you know which one of the 3 it is, you should be wearing your mask because it might be COVID. And we want to stop the spread as much as possible. You can get your COVID vaccine, you can get your flu vaccine, but there is no RSV vaccine yet. I just want to point that out. Next, please. I think Ms. Sandra asked me about this. So getting the flu shot if you do not have health insurance. Okay, so for one of your cheapest options, if you do not have health insurance and you need to get a flu shot, is looking at your local health department. This is the bread and butter of what a health department has been for decades. Health departments get special flu vaccines, they get them, and they are lower cost. Usually they are offered for free. So if you Google your local county health department flu vaccine, you should be able to call them and schedule an appointment for a free flu vaccine. They also might offer other shots. So it doesn't hurt to ask. You might be able to get your kids vaccinated there, depending on the local health department, if they need to go back to school and they don't have all their shots yet. They might have COVID boosters if you haven't gotten it yet. So call your local health department. If you go to a pharmacy, I know this is kind of, each pharmacy is a little bit different. They have coupons. Some of them are offering them for free at special events, and that's great. They are usually free if they have like a free flu day, something like that. But sometimes when they say a free flu vaccine, that flu, it's not free. You have to pay a copay or an administration cost because the drug is one price and getting it put in your arm is another price. And sometimes they'll give you the drug for free, but you pay to get it put in your arm. So check, ask for coupons, ask if they take GoodRx, because that's it's one of those yellow cards and they'll have them sitting on the counter at your doctor or at the pharmacy because that's a discount. Next, please, Maggie. All right, so now let's talk about RSV. So RSV is dangerous in 2 groups of people, babies and older adults. So let's talk about babies. RSV inflames your lungs. So think about how small a baby's lungs are. This is why it's so dangerous for small children. Kids can get pneumonia. You can get bronchitis. You can get a lot of different infections on top of RSV if you have it. So what do you need to keep an eye out for? If that baby was born early, this is something that we know that we need to pay attention to because more Black children are born premature, right? This is a huge health disparity, right? So if that child was born early or they were born with heart or lung problems, RSV is especially important to pay attention to. We worry mostly about kids under 6 months, or if they have some kind of autoimmune problem, or if they have a disability where they have trouble swallowing. These can all lead to really big problems. So what should you pay attention to? If they're struggling to breathe, check their fingers, check their lips, If they're starting to turn another color than normal, they're starting to turn bluer or purpler, that's a bad sign and they need to go to a hospital. If the baby won't eat and they're dehydrated, that's another huge problem because babies aren't that big to begin with, so they get dehydrated faster. Pay attention to how many times you're changing your baby. If you have not changed your baby as often while they were sick, that is a sign that they might be dehydrated and they need to go to the doctor. Next, please, Maggie. Okay, now what should older adults know about RSV? So again, it's a lung infection. You can get pneumonia. You can get a lot of other things on top of it once you get RSV. People who are 65 and older need to be especially careful, or if you have anything that is stressing your lungs already. So asthma, COPD, heart failure, because your heart and your lungs are very connected. What is an emergency? If you are struggling to breathe or if you're dehydrated. So pay attention to if you have an elder in care, if older people tend to stop eating when they're sick and they can get dehydrated really fast. So they need to be going to the bathroom at least 4 times a day. And if that's not happening, please go to the emergency room or go to another doctor. Next, please, Maggie. And then finally, Ms. Dorothy asked me about this. What should families who have a person with a developmental disability know about COVID? Developmental disabilities are actually a huge, I didn't know this. When I looked into it, there were 2 things that were most important in figuring out whether you were going to die of COVID: how old you were and whether or not you had a developmental disability. This is a big problem because if you've ever had somebody in your family, if you've ever worked, you know that folks have staff, right? They have caretakers. They need people in their lives to, get around, right? That's part of what caretaking is. And so they might not be living independently. They are exposed more, especially if you only have one caretaker, and especially if you're in congregate living, like an assisted living facility. So if you have a person with a developmental disability in your family, coming up with a plan to make a COVID-free bubble around them is incredibly important. So having backups for that caretaking team, because if there's only one caretaker and they get sick, who is there to provide that COVID-free care? Testing before you visit and come over. And then figuring out the best way to help that person understand how important it is to social distance, keep wearing their masks, all those kinds of things. So really, it's a team effort. So yeah, next please, Maggie. Yeah, that is our public health minute for this week. If you have any follow-up questions, you can put them in the chat or you can text me and we will get back to you. So
Thanks.
Well, let's snap that public health minute, the COVID bubble. I love that.
Good. Bring Meg back. I want to talk to Meg. Bring Meg back to me. Come back to me.
And
hey, Meg.
Hi.
We were talking about the Wellness Warriors, right?
Yes.
Tell us a little bit about what's going on with our Wellness Warriors. Let me tell you something to Mayor Bell and to Daki Nak. We are so happy about the team of people we have assembled. I mean, it's you see us in that, but we got a team of people, an army, and I don't like to use military metaphors, but we have a great group of people who are part of what we do, and we call them Wellness Warriors. Talk a little bit about them. I want to show some love to my Wellness Warriors.
Yes.
Okay, guys.
So we had a busy week with the Wellness Warriors, and we want to do some kudos. So today we had 3 of our Wellness Warriors presenting at the Communal Health Coalition. We had Miss Michelle, we had Miss Terry, and Miss Dorothy, who did an incredible job.
Amazing.
Incredible job. It was a fantastic panel. They came in, shared their experiences, and really gave incredible tips to people who are working in public health, right? We're talking about how do you expand who knows about public health? How do you expand the role? That's what they were doing today.
And it was a national audience that they spoke to with potential funders on the other end and just great agency. And they told our story, Mayor, and they did it in a way that inspired others.
Mhm.
That's wonderful. Thanks. Now, it's not just the Wellness Warriors, but we also have a star in our midst as well, Dr. Stephen B. Thomas, who spoke at the White House on yesterday. That's
Mhm.
yesterday. And you see him there like a preacher, out there with, really laying it out. And we really appreciate Dr. T for all he does. He's energy. He's that engine that keeps our vehicle moving. And so we are so appreciative. We love you, man. Thank you so much for all you do, both seen and unseen. And if we can bring a few of our wellness warriors up to just say a little something to Dr. T, let's do that while we got a minute.
Hey,
Anybody
Dr.
want to say
T.
something to Dr. T? Okay, Andre Russell,
Yeah.
all the way from the ATL, right in.
That's right, from Atlanta.
Atlanta,
You
Georgia.
can tell he's serious when he gets excited, because every time he does that, he takes his hat off. And I didn't know he was going to do that in front of the president and everybody. Great job, Dr. T. We love you.
Thank you.
Thanks, Andre. We got Dorothy all the way from from Pine Bluff. Now,
There you go.
remember where she's from, Pine Bluff, Arkansas. Hey, Dorothy, how you doing?
I'm great. How are you? Thank you for the opportunity. Dr. T, we really appreciate you more than we could say. And you just got us excited today. I really enjoyed having the opportunity to observe. I listened to the entire summit today, and I thank you so much. We really appreciate you.
Wonderful.
Thank you, Dorothy. You're such
Good.
a
Bring up Michelle Lamb. And let's go all the way to Ohio, right? What's going on? And what's going on, Michelle? How you doing?
Hello, everyone. I'm Michelle Lamb, the owner and operator of the Hairport Barber and Beauty Studio in Cincinnati. And I just really grateful to be a part of the Wellness Warrior. I'm grateful for Dr. T. He really took us there yesterday. He mentioned us so many times. I just couldn't believe it. And on a national platform, it was a beautiful thing. And thank you, Dr. T, and everyone that's involved in this, what we're doing, coalition.
Good. Let's go to Philadelphia. Thank you, Michelle. Let's go to Philadelphia.
Here in
Sandra
the house.
Jenkins.
Here
Hey.
in the house. Yes. I'm Sandra Jenkins, and I'm from the Philadelphia and Montgomery County region of Pennsylvania. And I would like to say to Dr. T, you are an angel in disguise. You are it. You possess gifted traits, the traits that we just so much needed in this industry. And one of them is your vision. Your vision is immeasurable. The other thing is your heart. Your heart is huge. We're going to protect it. And number 3, you got class. You got class. So Dr. T, just
thank you so much.
I told you we wouldn't be able to stop all of them.
This is my surprise.
Thanks, Sandra. Bring up Mike Dynamite Brown, and then let's go to Katrina Randolph, all in the Maryland and DC area. Let's bring up Mike Dynamite.
Hey, how's everybody?
Hey, Mike, what's happening, baby?
Really cool. Dr. T, you my main man. Dr. T, you took the essence of the barbershop and dumped it on the White House lawn. You told our truth. You took our truth and put it on the national stage. I'm forever grateful for that, just to be a part of this opportunity, the journey from the nucleus, from the time you walked into the barbershop in 2009, and to see this thing into fruition. That is just amazing to be a part of it. Love you so much. Thank you for all you do, all you poured into me and helped me grow as an individual. You're an awesome leader. Everybody, he's the chief. We the Indians.
Yeah,
Chief Dr. T.
Yeah.
Well, he gonna give you another name too, Dr. T. Okay, Katrina Randolph, Trey
Dr. T,
Studio.
you already know how I feel. Hello, everyone. My name is Katrina Randolph. I'm out of Capitol Heights, Maryland. I've been in business for over 23 years. The name of my salon is Trey Shades Hair Studio. Dr. T, you know, as I always tell you, you are a great man of honor. We so thankful to have you have birthed this Wellness Warrior Hair Network. Like Sandra said, it was well needed in our community for barbers and stylists. And we even thank you for this platform that you have put us on. We feel like we're in college now. We get so much education just being right here on this platform to be able to share in our communities. And I want to say thank you for being on that national platform on yesterday, mentioning me. I didn't text that watch, but I appreciate the humor you had.
I knew it.
It was great. I just thank you, Dr. T, because this is a huge collaboration, and I'm just excited to see all our wellness warriors connect and grow together in one common unity in the community. So we thank you so much, Dr. T. We're honored.
Another t-shirt.
Absolutely. Let's see if we can get Terry Branch up and
let me tell you, I'm over here scrambling, y'all. I've been in the salon. Look, I'm at my salon. I'm just leaving. There we go. Perfect style. I'm so tired. I done been on every Zoom meeting today I could ever think of. But let me tell you, I was scrambling with my other phone because I couldn't get the video to work. And I was like, no, everybody need to say something to Dr. T and he ain't gonna be able to see me. But anyways, Dr. T, you are so amazing. I was tearing up watching you yesterday. You're such a smart and just intelligent and classy.
Terry, just stay still. Don't once you get to a place, just stay still.
It's so great to be a part of this. The Wellness Warriors. The mayor Friday.
She's getting plugged in now.
You really represented to us. I mean, for us yesterday, it was just so. My head is still spinning, just thinking about all the. It was so nice. You just.
Man, that's what you say, giving you your flowers, Dr. T.
Right.
You know, that's what we
he
call.
He almost mentioned the airport and barbershop. Almost.
Yeah. Well, we gonna, Andre has a barbershop in the ATL, Mayor Bell, in the airport.
In the
airport. He has a barbershop in the airport at Atlanta Airport. Right. That's the busiest airport in the world. He has a barbershop in it. Right.
And we take our hat off on occasion.
So that's wonderful. So is it anybody else that did I miss anybody? I want to make sure that I got everybody in that wanted to make a statement. So I'm going to make sure.
Rochelle,
okay. Hey, Andre, would you allow me to continue to moderate this? I appreciate you. Thank you so much. If you would please allow me to do it, I would be grateful. So appreciative. Thank you so much, sir.
Well, let me just say, what an honor to represent you. And I said, there's no way I can come up in this place and not be as excited as you would have been if you were there. There were people walking around like, oh, I'm here all the time. I knew I wasn't there all the time. And they may not invite me back. But
you gonna come back, man.
They could not get enough of the Warriors and hair. And I told the mayor that now we own this space and there's a responsibility that comes with it. All barbershops are not the same, or salons, am I right?
Right.
And so now you've got a whole new way of differentiating your business. Mm-hmm. And that's the next phase we're going into now. And they want to figure out a way of really making you successful. So I want to thank all of you warriors for trusting us And the ones who stepped up today on that was a national webinar today you did the training on. And I just love the stories, and they could see that we have relationship.
Mm-hmm.
They could see that, and it came right through the screen. So buckle your seatbelts. This is just the beginning, scholars.
Absolutely. That's good. Well, thank you, scholars. Thank you for being a part of Dorothy, you want Michelle, you wanted to say something before you left?
Yes, I do. I just want to say this. The people that we were on the panel with today, the professionals, they really listened to us. They came back later once the webinar was ending to say what each one of us had planted in their head. So they were really listening. I mean, really.
That's wonderful.
That's good. Thanks, Michelle. Thanks, Katrina.
You.
Thanks, Sandra. Thanks, Mike. Thanks, Andre. Thanks, Greg. We need to thank somebody else. I need to hold up. You can't start thinking and then don't thank everybody.
Yeah, that's why he almost.
Thanks, Terry.
I had to come back in, y'all. Could y'all hear me when I was talking?
Yeah. You can make your last statement because I see you got a better.
Come on in.
Bring her back in because she was
and she was
going
wonderful today on the
Okay.
panel.
Thank you.
Okay.
Just outstanding on the panel.
All right. So we have just 14 minutes left. That's how quickly it goes by. But thank you for the Warriors for that. Dr. T, that was a little special something that we wanted to do for you.
They did that behind the scenes.
That's out of love. Yeah, you didn't even know it.
No.
Yeah, that's the little love we wanted to give to you, man. Mayor Bell, I want to talk about where do we go from here? You know, you have looked at this thing, you know the missing pieces, right? What do we need to do? And then how can our barbers and stylists be of assistance in helping bring those things to fruition?
One of the things that I'm always big on pressing the issues and bringing the concerns to the politician, to the elected officials. Your message is spot on, that you've got the power where the power lies with the people, and with the barbershops and the beauty shops, you hear it all, you see it all. People trust you with their most intimate feelings and things that are happening to them. So you have so much power in bringing the message to the elected officials. And I think that we need to keep raising those issues and keep the concerns before the elected officials. And keep our voices heard.
That's powerful. Dr. Knock, you have obviously, being a candidate, you got a chance to really get ears on the ground and really to hear people. So what do we need to do? We need to hear your voice in terms of what you see, and what do you think the steps are towards bringing a more equitable society, more perfect union.
Yeah, I like that. I think there are a number of things that we can do. One thing we can do is to help dispel the myths in our community. I think there are a lot of myths out there which have kept people from getting vaccinated. I know a number of people who believe that COVID wasn't real, and there are still people out there who believe COVID isn't real. And yet there are still people dying. I know people who have died who told me COVID was a hoax, and they died of COVID. So I think we need to continue to dispel the myths, and it needs to come from people who they trust. That's from us as we're talking to our communities. We have to also develop a culture of health and well-being. We have to make sure that, we illuminate good health as being the cool thing to do, right? And that we help people understand what it is that promotes good health. We need to promote healthier diets and exercise and those things that are just common general knowledge that don't really resonate with people. You know, I don't like getting up to go to the gym every morning, but I like the results that I get because I go to the gym every morning. And so we need to continue promoting that. I think we also have to promote personal responsibility as well as engagement. We have to get people engaged in what's going on around them. We have to help them understand the importance of selecting the right legislators and making sure they're informed so that they can make good, responsible choices and decisions about who they put in office, who will be the guardians of our health and well-being. There are a lot of things that impact our health, things such as the environment, and many people don't care anything about the environment, but the person I ran against voted in favor of allowing corporations to dump waste in our water and to pollute our air. And that's important. It's important that people understand what the impacts are. We also have to begin to promote and educate people about climate change and helping them understand the impacts of climate change and why it's important to make different decisions about what we do. You know, soon people are going to have to make decisions to drive different cars and to, you know, not dump certain chemicals in our water, because water is a precious resource which is in limited supply. And as climate change happens, those externalities also impact our health, our well-being, and various kinds of things. So I think there are a lot of things we can do. And as Mayor Neal would say, you have the power. You know, you have the power to change things. Wow. And I think people should understand that and embrace that.
Yeah. You know, I wanted to go back to Mayor Bell. You know, let me see. We got Sharon Cooper that came up. Let me bring her up, and then I'm gonna. Well, let me bring her up first, right? Dr. Sharon Cooper, a part of our family. Hey, Dr. Cooper, how are you doing?
Good evening, everyone. I do apologize for being late, but better late than never. Okay.
Absolutely.
Love the hat. Love the hat.
Oh, we love that.
Oh, thank you.
That's what they say on that's on Fleet, Dr. Cooper. Good. Your thoughts about what's we were talking about Dr. Thomas being in the White House. You know he's and he's
so proud
representing the family, you know. So we gave him some flowers, you know. I thought I had to give him some tissue so he wouldn't cry. You know, go ahead.
Well deserved. The message is clear, and it's critical what Dr. Thomas is doing and all the Hair Network and the Wellness Warriors are doing. I attended a service for a relative who did not follow up. So on his health care, died at a very young age. So he transitioned last week. The service was yesterday. So it is absolutely critical, the message that we have to get across in the community, not only to provide that conduit to healthcare, but getting those people connected and following up. And those shops, the salons, and engaging the community are absolutely critical. And the message is loud and clear, the effectiveness of these programs. And this serves as a model because we have this in LA. We have that barbershop model in Pittsburgh. Yes, in Pennsylvania. And you hear more and more about these models popping up across the nation. But the effect that we're having here in Maryland, that's going to serve as a true proof of concept, how these programs have impacted the health and connected folks to the appropriate services at the appropriate time.
Thanks.
And Dr. Thomas, Mayor Neal, all the Wellness Warriors, thank you for all that you do.
Thank you so much, Dr.
Thank you
Cooper.
so much.
She's one of us.
Don't mess with us now.
Absolutely, man. It's wonderful. I want to leave out because being a funeral home director and owning your own funeral home, we know that a lot of people died based on diet. and their lifestyles. What can we do to shift the paradigm on people being intentional about taking care of themselves? Doc Enoch was talking about her going to the gym because she wants to be healthy. And she doesn't want to do it all the time, but she wants to be healthy. So what is it can we do? What can we say? What can barbers and stylists say to their clients about how to be intentional about being healthy?
I think one of the things is to keep showing them, if the barber and the stylist if they're out there going to the gym, or they're seeing them like in my area on the sidewalk walking. And that's one of the things that I actually did through COVID, because I am the owner of the funeral home and saw so much death and had to have an outlet. I actually started running. I hadn't run in over 20 something years, but I started running and entered road races. And my partner and I were the only two out there in the beginning, but eventually we started seeing more and more people out there walking and running. So I think one of the things that we could do is start showing up ourselves, the barbers and the stylists, and then the messaging, hearing it over and over again and making sure that the right message is out there, and the healthy eating. As Dr. Enoch said, we have to be intentional about what we're putting out there, and intentional about our health care, and taking ownership of our own health, and taking ownership of our family's health as well, and providing adequate fruits and vegetables. That's one of the things that we started with the food bank, is requesting more fruits and vegetables. As we taught more, our folks learn more. I'm in the South, and we love Southern cooking, that fried chicken, fried catfish, all of that.
I love that.
We started
taught more.
We started providing.
That's good.
Hey, you get me hungry, Maribel. Just go ahead. I'm sorry.
You talk about
I digress. Go ahead.
I was just saying, Greg Allen says that he's on roller skates. We need to use maybe our newsletter to highlight the ways in which the barbers and stylists are role modeling what we're talking about. In fact, they talked about that at the session today. Each one of them, how when they got their vaccination, they did it in public, and they let the people see that I'm going to walk the walk and talk the talk. It makes a difference.
Yeah. I got my last vaccination last week since we did the show.
Yes.
So, it's important that we promote our protection.
That's right.
Right. And that's one of the things that we're going to do.
If you go, I'll go.
Doc, that's right. That's right. And that's a t-shirt, Andre. Dr. Enoch, we right now are looking at something that's historic, and we don't have a lot of time to talk about it. But Nancy Pelosi said that she's not going to seek leadership in the Democratic Party, nor is Steny Hoyer, who is out of Maryland, right? And nor is James Clyburn, to leave way for hopefully Representative Hakeem Jeffries and Catherine Clark. So that's something we need to talk about as well. It's at some juncture you need to pass the torch.
Yeah.
Right. And I hope that at some juncture that the torch is passed to you, because you are the kind of leader that we need, not just in Ohio, but we need nationally. So
Absolutely.
I wanted to say that as we get ready to leave. Dr. T, let's give us some snaps for running for office and for doing so.
Absolutely.
Love you so much, Dr. Enoch. Dr. T, love you, man. Captain.
Took his hat off again.
You got it.
It doesn't matter how much you got up there.
I told you he'll take it off.
That line works every time. Ashish Jha came up to me and just hugged me, And he felt the family love that the barbershop atmosphere brings. And that's exactly what we need to spread.
Absolutely. Mayor Bell, thank you so much for hanging out with us. This was a pleasure to have you just join with us and with your authentic, just wonderful self. Thank you so much. Love you. And Dr. Enoch, Doc Enoch, that's my name for her. Man, you all gonna, if you all don't know about Dr. Vanessa Enoch, look her up. She's incredible. Dr. Sharon Cooper, thank you so much. You are such a wonderful person and such a great asset to our family. So thank you so much to all my wellness warriors and everybody, Dr. Ritter and everybody. Thank you all so much for this. This has been a wonderful day, a wonderful expression of hope. We saw in the beginning where it says community was the largest of the word cloud, which is common unity, that we find our common interests in each other. And so I cannot be what I ought to be until you are what you ought to be. And you cannot be what you ought to be until I am what I ought to be, because we are interrelated and interdependent. And as always, I'd like to leave you with these two words. Remember that I love you with the perfect love, but more importantly, remember this: you got the power. Until the next cutting edge, take care of yourself. You owe it to yourself. Happy Thanksgiving for next week. Love y'all. Take care.
Do your protections.